Here we go. So welcome to Work-Based Learning, a key strategy to address Iowa's healthcare workforce shortages. My name is Kathy Leggett. I am the Business Engagement Liaison at Iowa Workforce Development, and I am here with a great team of presenters who are very active in work-based learning strategies, using them in the healthcare arena in a variety of different ways. So I'm super excited for them to share what they're doing with you. I do have a couple of uh, uh, reminders to put questions in the chat. So we will do our best to monitor that as we go through. And then also to let you know that there will be a recording, and the slides that we share will be shared out with you and anyone who registered for this. And then, you're free to share them from there as well, because there will be a lot of great information. So I'm going to have panelists do a quick introduction, their name, their title, and their organization, and then they'll be coming up through our agenda. So Dana, if you can go first.
I am Dana Neemann. I'm a registered nurse, director of education and patient experience at Crawford County Memorial Hospital in Denison, Iowa.
Great, thank you. Kat.
Good afternoon. I'm Kat Neemann, and we are of no relation, but that's super fun. I am the Director of Human Resources at Cass Health in Atlantic, Iowa.
Wonderful, thank you. Jennifer?
I'm Jennifer Down. I'm the Workforce Development Partner for Mercy One. I actually cover the entire state, so all 19 ministries.
Awesome. And Tammy?
I'm Tammy Kacer. I'm an instructional coach for Mason City Community Schools, and I work with our healthcare occupation pathway.
So great, thank you. And then I do want to just acknowledge, you'll see also we have Abby Tibbetts, who is on our work-based learning team here with the Iowa Office of Apprenticeship, and Jody Smith, the Iowa Department of Education work-based learning coordinator. And thank you also to Jen with our communications for helping us get through this. So I am going to go ahead. I do have a little bit of labor market information I wanted to share, just kind of some level setting on the healthcare in Iowa. And so thank you, Abby. And again, there's a lot of information on these, but these slides will be coming to you. But I think really just to showcase the importance of the healthcare and social assistance industry in Iowa, you can see this is 2025, October through December. Healthcare and social assistance is our leading industry for employment in Iowa. At 15.1% of all of the employment. So go ahead and switch, Abby. Perfect. And then I wanted to share this information. So when you break up that industry category, it's made up by ambulatory healthcare services, so clinics and offices, nursing and residential care facilities, social assistance, and hospitals. And you can see all of those have quite a good chunk of the employment in Iowa. Next slide. And these are forecasts. So between 2022 and 2032, this is the statewide top sector projections by numeric growth. And again, you can see healthcare and social assistance is projected to grow or really outpace the other industries in growth over that 10-year period. Okay, Abby. So also top detailed industries adding jobs to our economy. And again, you can see the ambulatory healthcare services, social assistance, the nursing and residential, and hospitals, again, all high on that list. So just again, to make the case that we need many strategies to help fill the jobs and the need to provide care for people in Iowa throughout all of these different ways that's done. Abby, if you could switch. Okay, so this is occupation family. And so this breaks it down a little bit more. And again, this is a 10-year forecast. So healthcare support occupations are there. You can see that those are huge. And then healthcare practitioners and technical occupations, again, growing widely in the next, well, it's less than 10 years now. The support occupations are going to be, you're going to have your aides with that, aides and assistants, and then healthcare practitioners and technical. Those are your technicians, your nurses, your nurse practitioners, your doctors, all of those positions. Go ahead and switch, Abby. And then here, just looking again at the specific occupations, you can see the home health and personal care aides, the forecasted annual openings, nursing assistants, registered nurses, thousands of jobs. Obviously, like down, we have the clinical laboratory technologists. Those still also, as you can see, have a higher annual growth rate, but even look at nurse practitioners, 5.3 annual growth rate projected. And then, so again, just opportunities and needs everywhere. Okay, switch it. And then here again, just multiple ways to look at the growth in these areas. Go ahead and switch, Abby. And then this just shows it in the annual growth rate for all of these specific physician's assistants, speech pathologists, medical assistants, technologists and registrars, physical therapists, just again, so many opportunities in the healthcare field. Go ahead. And here we are again. This is the current top industry job openings. This was as of October 20th, 2025. And there we are again with healthcare and social assistance. Okay, Abby. Okay, go ahead. I think you guys get the idea. There's a lot of jobs and a lot of opportunity. Keep switching. Go ahead. You can use this maybe in the future. And so basically, yes, 36 of the top 100 job openings are healthcare related occupations. And that's 19% of all job openings in our state. So this is go ahead and switch, Abby. I think that may be it. This is an incredibly important topic. And we're going to talk, and you'll hear from people with different strategies of how they're using work-based learning to get interest in the healthcare field, to provide experiences, to train, and the workforce in a variety of different ways. So thanks again for joining us. And I'm going to go ahead and turn it over to Dana. So she's going to talk about how they've been working to build their healthcare career pathway. And so with really lots of creative and great programs. So Crawford County Memorial Hospital, Dana, go ahead.
Thank you very much for having us on as me as a panelist, and then some of our other key drivers as attendees. And so what I would like to do is just kind of give you a little bit of an insight. I became the director of education. I was a nurse director and a house supervisor back in about 2017, 2018. And we recognized that in order to recruit to small town Iowa, unless you're from small town Iowa, people don't necessarily have a burning need and desire to live here. And so we recognized that we really needed to grow our own. And how we were going to do that is we needed to start engaging our community. If you could switch slides. So what we started doing is our pathway really started with, being present and visible in our community, engaging with daycares, preschoolers, different elementary schools, middle schools, high schools, career fairs. And we did that in a number of ways. We went out to the daycares. We had summer programs where the daycares would actually come up to the hospital. We would do, kind of a meet and greet. They would get to see some of the patient areas. So then it wasn't quite as scary if them or their family members had to come in. We took it a step further and we started doing like minimal camps and kind of daytime activities. We were teaching kids Stop the Bleed long before they knew what Stop the Bleed was. Talking about different things. If your friend falls off the top of the slide, what are some things that you can do for them? And really trying to take that mystery and that fear base of healthcare and healthcare systems out of that. We started, we've had a strong presence in our elementary schools with community partners with a lot of our providers. This year, we actually started going out quarterly to our middle school for our 8th graders, and we're doing an educational series with them. And it's about two different days during their class time where we are talking about the availability of healthcare careers. And not all doctors and nurses, it's not just doctors and nurses that work in healthcare. You can be in a number of different type of industry, because without one, you can't really function. We attend multiple career fairs at different high schools, as well as a lot of colleges. We started our very first Scrubs camp in 2018, and I've got a little recap from this year. Let me tell you, where we started is not where we're at today. And so I think the hardest thing is just being okay with just starting, and then taking that experience, reflecting back on that and saying, okay, what did we do well and what can we do better? We have expanded out our pathway. We do a number of observation hours for individuals that are going into colleges, to universities, individuals that are like, I think I might want to do this, but I don't know. And so we've set up an actual pathway where students and even men and women in the community can come in. They fill out the necessary paperwork that are required, and we can give them minimal observation hours. We do a work-based learning through our area Job Corps, as well as we have a structured career exploration program with our area high schools, where they go in as part of high school credit and they go through the different career areas, and we give them content to work on. We are a huge clinical site, and I've got some statistics at the end of the presentation that's going to talk about how we've really grown our student population. And last summer, actually, we just completed our second paid intern program. If you would flip to the next slide, and if you're okay sharing your screen, we had a little technical difficulties or allowing me to share screens. I wanted to give you just a little bit of a recap here of Scrubs Camp 2025. Sorry about that. That was me in 2025. This year, we went back to the drawing board a little bit, and the students were able to do a lot of different hands-on activities. In surgery, the kids were able to actually perform different sutures on oranges with one of our general surgeons, Dr. David Wright. When the students were able to go in with anesthesia, Ed Cutler, CRNA, walked through and explained a lot about what it is to protect someone's airway, as well as really support them and keep them safe during a surgical role. When we went through the lab department, the students were able to actually look at slides underneath the microscopes and look at different microbes, gram-positive, gram-negative rods, which are different types of bacteria, and how they grow out. And then they also were able to set some slides. Ultrasound is always a fun station for students. This year, they got to do not only heart ultrasound, so echocardiograms. The students had the opportunity of performing or assisting our sonographer with doing an ultrasound on babies. We had a couple of pregnant staff members that volunteered. In the emergency department, we had a great opportunity to run through a critical event and how every person in the team plays such a key factor and has such an amazing role and responsibility in order to really enhance the outcome of a patient's condition. One group was able to go out and hang out in a helicopter, and we had a flight team come in and show the space. Had our clinic staff simulate what it's like to do strep testing, and the kids were able to perform strep testing and the controls and look at the different anatomy of the throat and why it's important to swab appropriately. On the inpatient unit, they went to a patient room, and this time they got to practice doing lung sounds and vitals. Something new this year that was really exciting is we had Tammy, our speech therapist, really speak to the kids about her role as well as all of the other rehab department. We had a non-clinical panel because a lot of times people think only doctors and nurses work in a hospital. Guess what? We're all part of the team, and without one aspect of the team, the other one cannot function. So I will stop sharing there. That is, and then I'll allow you to pull up the rest of the slides. That's a recap of 2025. Now, mind you, when we started, it was not that polished by any way, shape, or form. And so, it took a little bit of time to really figure out what was going to work and what wasn't. And where we started in 2018 and where we finished is definitely not the same. We started doing, we track attendance, and back in 2018, this is all of the scrubs camps that we have had over the years. We were able to get one in 2020, so we were pretty proud of that before the pandemic. And then as an organization, we could not safely open back up until about 2022. And so we did go in smaller groups and do more tours and stuff, but you can see our attendance through our scrubs camp from that time to now. If you go to the next slide, this is a sample agenda of what we have for our groups. And so we identified that instead of having 30 kids in the building for one day and trying to fit together 4 micro groups, it's better to actually host it over 2 different days for our organization. And so we max out the kids of about 15 to 16 per day. And then that gives us an opportunity to have much smaller groups. And so we always have, a full hour with the rehab services department. And then we make sure that we have a chaperone that is available to be there with the children to really help combat any questions, also help them stay engaged with the speakers and help the speakers stay engaged with the students. If you go to the next slide there, this is a little bit of a success story that we have. Lauren was actually a Scrubs Camp attendee. She has done observation hours. She is currently a student nurse at Mercy College of Health Science. And so at the end of Scrubs Camp, they get a certificate of appreciation and participation. A lot of kids that have gone through Scrubs Camp actually have that posted out at their graduation. And so you can see little Lauren in the middle. That was actually her badge picture, because all of the kids get an employee badge that says Scrubs Camp attendee, and it has their picture with our hospital logo, and it's on a little card. And so they still get to have that. And then on the right-hand side, that is actually Lauren. She was in our very first paid intern program. And so there we are teaching her on-the-job phlebotomy. If you go to the next slide, another success story that we have here is actually Jaseni Garcia. So Jaseni, the picture on the left is when she was a Scrubs Camp kid way back in the day, and she was in the OR with Dr. Wright, and they were putting chest tubes in pork bellies. On the left, sorry. On the right, she is now a Daisy Award-winning employee. And she is an absolutely outstanding member of our healthcare team. If you go to the next slide here, I'm really proud of this one. This is student Ellen. She, on the far right-hand side, is actually her Facebook post from back right after she had attended Scrubs Camp back in the day. And she's like, "Can I start an IV on anybody?" Fun fact, Ellen is actually off on maternity leave. She is a full-time employee, and she found her Scrubs Camp badge right before she actually chaperoned Scrubs Camp this fall. And she flipped me a text with that picture. She goes, "I was at Mom and Dad's and look what I found." And so she worked as an EMT. She was here as a nursing student, and now she is one of our BSN nurses. If you go to the next slide here, we started tracking students in 18-19, but we didn't really have it figured out. And we recognized that really students have to live in one department. It can't be fragmented by departments, because then it doesn't streamline it as well. And so we really streamlined it in 2022, but we started, we're still just honing it in. And so you can see our students by year, 2023, 2024, and 2025. The high school students are in blue, and that is area high schools. So that's not just Denison, that is also surrounding communities. We do have an active Job Corps program in our community, and we serve as a clinical site. We have a number of college and universities, and this is our total students. So from January 1 to October 2025, we have had 183 students inside our critical access 25-bed hospital and our rural health clinic. And so that's pretty amazing. Like, we're very, very proud of that. We do have a hospital-based EMS, and so that does help with some of that, because a lot of EMTs and paramedics are getting their clinical rotation here. The next slide is going to talk a little bit about our process, and anybody that is interested, you can always shoot me an email, by the way, at the end of the presentation. I'm more than willing to share information. So when we realize that students really have to live in one spot, on the next slide, you'll see, it does serve underneath education inside our organization, because that's what makes sense for us. We do have a strong collaboration with human resources. We have policy in place. We have policy in place to support making sure we're in line with Iowa code and immunizations, as well as HIPAA and all of those things. There is an application form. We have a HIPAA statement. We have receipt and attestation statements for students and parents of minors. And we have that both in English and Spanish because we have a strong Latino population. The biggest component of this that I would have to say is not just the onboarding of the students, but those evaluations. Those evaluations are so critical, because what we do is we save those in the human resources department underneath students. And several years down the road, a lot of times these students are coming back and saying, hey, I once was here as a student. And we pull up those evaluations and we determine, okay, were we a good fit for them then? And if we weren't, that just gives us an opportunity to have a conversation on the front end. And we've done that. And then with that, we also do follow up. And so we do a couple times a year, we are following up with the previous attendees of Scrubs Camp, as well as previous students inside the organization. We send them emails, sometimes we'll send them a card, and those kinds of things. If you flip to the next slide, I'm really, really proud of this one, because of the fact that we have streamlined our medical students here at the hospital. So we are on track to have roughly 19 PA, MD, DO, and nurse practitioner students through this 2026 academic cohort. And I will tell you, a couple of the students on this list are local. They're local, and they are from our community. And then this next one, because I wanted to be cognizant of time, I mean, I could talk about this all day long, and Kathy knows that, is just really a thank you. And this, in this particular picture, the young man standing directly to the side of me, he was a paid intern. If you go over, you're going to see Lauren standing next to Brooke over there on the far right. She was a paid intern, as well as in the second row, a couple over, actually directly to the left of Lauren, there is Lola and Ashlyn, and they were also paid interns, but they started as Scrubs Camp kids. And so it's kind of like, all of this work and in building on this, they're our future. And so we have, as an organization, everyone embraces this opportunity.
Thank you so much, Dana. And you had your contact information. That'll come out to everybody. Dana is an amazing resource. And I'm telling you, she's worked through so many things and, developed. She is an amazing resource. So thank you again for sharing your quick, and there's a lot more you could share too. I'm sure all of these panelists could do that, but thank you so much. And now I want to turn it over to Tammy. Tammy, you can take it away. And actually, Tammy is with the Mason City Community Schools, and she's going to talk about their healthcare career preparation opportunities. So we're looking forward to hearing from you, Tammy. Thank you.
Oh, thank you. This is just our second year that we have been doing our healthcare pathway. Actually, I'll back up. We've been doing the pathway for longer than that. We've had lifeguard training and CNA training and things like that through our community college on NIAC. But last year, we really got focused on a career pathway and focusing on healthcare when we joined in a partnership with Mercy. And Mercy One has been an incredible partner. And I think that's one of the keys, is just having a really good partnership with whatever your local healthcare organization is. And that's been a big success to our having success. We have seniors only, and it's a semester long course. And so I'm an instructional coach, and there is one of our high school science teachers who is our anatomy teacher. She is the other co-teacher in the class. And so we have the students for a full semester. And during that class, we do everything that you can imagine. We do a little bit of a just a refresher on anatomy. One of the prereqs is to have taken anatomy, and they're seniors, so basically they've all had it. But then we really go out a lot. We're on the Mercy campus a bunch. We're out at NIAC quite a bit. We visit professionals out in the field. Professionals come to us, which has been so wonderful. We are probably actually in the classroom, I would say 50% of the time, and the other 50%, we're actually out in the field learning from real professionals. And that has been, I think, a really big success to our success as well. The second semester, students can start to do job shadows, job internships. I actually have students right now starting to do those job shadows as well, just because they are so interested in getting started. And Mercy has been great about letting that get started as well. I'll tell you a little bit about the pictures, but we'll go back to talking more about those. The first picture on the left is out at our community college. We do, one of our units is microbial safety. We talk about superbugs and things like that. And we have the ability to test all of the bacteria that we gather from throughout the school. The students have a real fun time with that. They have little badges. They're part of the Mercy microbial safety team. And I tell you, the stuff that grows inside of some of the crocs in the building is pretty nasty. But we analyze them here at school, but then we also take them out to the NIAC labs and really gram stain them and look at them even further, and it's pretty interesting. The second picture I'll come back and talk to later, but that's part of our, I have automatic lights, sorry guys. That's part of our phlebotomy group that I think Jennifer might even talk about a little bit, but that's a really fun group, and I'll talk more about them. And then the final picture, the one on the right, that's a group of students last year who is actually out on the Mercy campus, and they were doing some phlebotomy testing with some of their equipment. So if you want to go to the next slide, please. The next slide kind of talks about a little bit more about what our class is actually about. One of the big, wonderful things that we found is that we started by thinking, when we started this partnership with Mercy, we thought we would basically be training phlebotomists, X-ray, surgical sterilization techs, and pharmacy techs. And I'm also a certified pharmacy technician. And as it started to evolve, we found that there was a lot more to healthcare than just those three areas. And Mercy also was finding that there were a lot of other areas in healthcare that they had some need for. And so as we started to kind of grow this together, we did and still do focus on those three areas. But it also became very apparent to us that we needed to broaden this and expand it to cover every area of healthcare, both patient-facing and non-patient facing. Because when you look at the needs in our area, we have an aging population just like the entire state does, but there were just so many more areas of healthcare that the students were interested in. So we decided to really start exploring it even further, and Mercy was gracious enough to actually let us do that. So next slide, please. Part of the why, I think, and this was a slide that we use at some of our other presentations, for us, it's really the student disillusionment. We have some students who, I don't know, it's not that they're really disconnected, but they have a gap of time in their day where they have a study hall, they maybe go off campus and they might go to work, but it might be in an area where they're not really in a career path. And so what we decided to do was see if we could combine that time off that they had with targeting something that they were truly interested in. And so I think that's where we have found the best use of our time, was trying to fill that disconnect and that disillusionment with the kids. So I think that's what the best part about this has been for us. Okay, next slide, please. Okay, so here's what we provide. The industry recognized credentials, I think, have been what has been the biggest eye-opener for me. We go through all of the training that we need to. with healthcare in our healthcare class. They go through bloodborne pathogen, they get HIPAA trained, they do child independent abuse, all of that kind of stuff. But starting this year, we're also doing BLS certification through the American Heart Association. We have partnered with also the fire department, and we will be doing second semester. We will be training EMTs. And so it's a brand new partnership that we're doing with NIAC and the fire department. One of the prereqs for our EMT program is that they will have had to do health first. But that is going to be pretty intensive. It will be right here on our campus, on the high school campus. And so they'll be getting NIAC credit as concurrent enrollment, as most of our things are. But then they're also getting that certification as well. They'll be training with the fire department with those EMTs. And it's really kind of cool to be able to offer that. We had several students last year that were interested in learning more about being an EMT. We were able to do job shadows with Mercy and their EMTs. But in our area, the fire department does have basically the entire city and county. And so that's been a wonderful partnership as well that we've just started to grow this year. The other big certification, pharmacy is one that is a little bit trickier to do on a hospital setting. And I know this from experience as well. In order to be board certified with pharmacy, you need to have like 500 hours of that clinical time in. And that gets a little bit tricky when you're working with high school seniors. Mercy does a great job when they're training their pharmacy techs. They take them on full-time, pay them 40 hours a week and just train them in-house. And so that was a tricky one for us to navigate at first. I took the curriculum. We tried to kind of navigate through that curriculum. I had students meet with me in the afternoons last year. So they had health ops in the morning. They met with me in the afternoons. They went out and did a little bit of job shadows in the afternoon, but we still were having a hard time meeting that 500 hours. And so it's best really for, if you're considering doing some kind of a certified pharmacy technician, to really wait until they turn 18 and then just go on site, go onto the Mercy site or Unity Point or whoever your partner is, going on site for that. We do have a couple of retail pharmacy partners that will take them. They can get more of those hours in and more flexibility over the course of like summer and really like crank those hours in. But that one has been a difficult one just to get them during the school year. Summertime, you have obviously much more flexibility. And so that one we are going to be rolling out with a retail partner for second semester, but the EMT will be. The other thing I can't stress enough is if you have access to a community college, hooking up with them and using them or partnering with them for those concurrent enrollment courses is very, very key. Our students that we have in health ops that are already CNAs are so much better prepared to be out not only in job shadows, but also out in when they are able to do internships and things like that. They already have like all of the medical terminology, all of that. I mean, some of their clinical hours are already done. Those relationships and having some of those concurrent enrollment courses taken care of just really helps to ease the burden on them in their school days. So then they have more time to be out on the real campus. I'm not sure what I have on the next slide. I hope it's pictures. Oh yeah. One of the things that we found with our students is that they wanted something quick and easy to take a look at, because our seniors this year came in and said, why did I not know about this when I was in middle school? Why am I just learning about this now? And so kind of going along with what Dana was speaking about, we realized that, it's really great to have like, the career fairs and everything like that, but it seems to be that students listen to other students, maybe more so than they listen to us adults. I mean, as a teacher and an educator, I think they're always listening to me, but in reality, they really listen to their peers a little bit more. No offense to the other educators that are listening. And so some of our students said, okay, we're going to take this show on the road. And it's not just with our healthcare pathway, but it's with all the pathways. They want to really take the show on the road. And so they're in the process in our business pathway of developing these wonderful new take it on the road kind of like things, brochures. And they're going to have QR codes that they can scan. And so this is like one of their first ones that they're going for. But they're taking the show on the road. And so they're going to be going down to the middle school. They're going to be going to the elementary, like Dana talked about. We have, through our partnership with NIAC, we have access to their SIM center and all of those kinds of things. They have healthcare camps. They can get on the ambulance, on the helicopters and things like that. But they want to be able to go tell the younger students about that so they don't have to wait until they're seniors, because I think that's just kind of too late. So they're going to take the show on the road. I do want to show just a couple more pictures if I could. And so if you skip a couple, I have if time allows, but I want to show you some of the students in action. Our final is a reflective final, and it's just really cool to see what the kids pull away from. The picture that's down at the very bottom where they're kind of peering over those tools. Surgery at Mercy is amazing. They come to us and they let us go to them. And so those are a whole bunch of surgical tools that they got to actually practice with. So we call it, I don't know what Gina called it, but it has some kind of a fun name. But it's basically they practice passing the tools, and they learn about all the different types of tools. There's a really gross one that where you have to like hold back your belly if you're like going in for surgery. And they just get to actually interact with the tools. These are not sterile ones, obviously, but they get to interact with them and they just have fun. The bottom right one is we have our phlebotomy arms. We bought them for class. We also use the ones at Mercy. That's a Mercy nurse, a phlebotomist, who actually is working with us. We practice all the proper techniques, and then we use those as well. Shout out to Peter Larson. He works for Mercy, and he's just been incredible as well.
Awesome. Okay, I'm just sorry, Tammy. I hate doing this to any of you because you have such great information, but I do have to move us on. And so thank you so much. Such great opportunities for your students. And this is all where it begins. So what a wonderful resource. And thank you. So now let's move on to Jennifer with Mercy One, and she's going to talk about her internship program.
Yes, thanks for having me, Kathy. I'm going to talk a little bit about a program that we put together this past summer. It was a pilot program, so it was new, so we're learning as we go. My role here at Mercy One, I do cover the entire state, but my entire role is to set up specific pathways for high priority roles. So I don't do a lot of career exploration unless it's with the intention of these individuals becoming colleagues within the organization. So my focus is generally on students 18 to 24, but when we put together this program, we did have 1 or 2 17-year-olds that were just really ready to go and ready to take on something like that. But most of the time it's for students who at the end of the program, they're either going on to get maybe an extended degree or they're going to a different program, or they want to stay and become employees or colleagues with Mercy One. So that's kind of what my scope is. This summer, we were awarded the Youth Opportunity Grant through the state of Iowa. So we applied for that grant. I don't know if a lot of you are familiar with that grant, but when you apply for this grant, you don't find out if you get it until like 4 weeks before you got to have your entire program put together and ready to hit the ground running. So it was all new to me. I came into the role just 1 year ago. So I literally hit the ground running. So we applied for the grant shortly after I started, and with the help of my Trinity team, I'm with the system office in Michigan. So Trinity Health helped out with the grant writing portion of that. We were awarded the grant, I believe, I want to say like May we found out, and our program started in June. So it was a summer youth phlebotomy program. Tammy can kind of remember how hectic those first few weeks were. We worked really closely with the Mason City school system. We worked closely with IJAG in Iowa. We pulled in a couple other community partners, but essentially it was an 8-week comprehensive phlebotomy training program that also provided additional training in just life and employment skills. So the main focus was phlebotomy. We wanted these students to be eligible to sit for that phlebotomy exam when they finished and have enough hours in for that, which they did. But we also had some financial literacy training. We did job readiness skills, introduction to resume writing, and some of these students had already been through those programs, but some hadn't. It just depended. But the main thing we do for these types of individuals is we actually onboarded these students as colleagues. I mean, they were student colleagues, but they were onboarded with our organization. So they went through the full onboarding and orientation program, just like I did. And then it was a paid internship program. Why did we do this program in particular? We had a 40% vacancy rate in phlebotomy or clinical lab technicians in this area. And so we kind of thought, okay, we're going to use the Youth Opportunity Grant to open doors for youth, because essentially that's what the grant is for. But in the same breath, how can we do that and also bridge a gap where we have, some missing colleagues? So that's why we chose phlebotomy. Everything I do is strategic. So I go through extensive conversations with my CHROs, the key stakeholders, talent acquisition, human resources. So I'm not allowed to just say, hey, let's do this program. They have to be like, Jen, this is where we need the program. This is what we want you to focus on. So we do involve our internal colleagues quite a bit in that. The structure of the program, it was, like I said, 8 weeks. We had 10 enrollees into the program. We actually, I think, had 12 total applicants that followed through on all their onboarding, and then 2 dropped out. So we ended up with 10. They were ages 17 to 24. And like I said, we really partnered with Tammy over at Mason City Schools for referrals to get these students in. IJAG, I work with IJAG pretty closely across the state, but our branch in that area was really willing to step up and send us some referrals and help us recruit. And then we also worked pretty closely with the Iowa Workforce Development Board for any reverse referrals that way as well. The buy-in from our internal staff was huge. At that time, we had a CHRO that was really moving forward on a lot of work-based learning opportunities. She had a lot of ideas. I want to say right after we received the grant, she actually took a different position. So we had a new CHRO come on board who, was like, what is this? I didn't know anything about this. So just having to make sure everybody was on the same page, that was a little bit of a challenge we faced. But it also, the buy-in of the staff in Mason City, they're amazing. I got to work with that team really closely, which is probably something I wouldn't have had the opportunity to do had I focused on Central Iowa first. So the CHRO in that area was instrumental in just being like, I'm ready to go, Jen. You just started this job. Let's get a program going. So that's what we did. We worked, kind of an amazing thing. We actually worked really closely with the Workforce Development Board on some Title I funding. So we were able to piggyback that for wraparound services, part of the tuition costs, the scrubs, the shoes, the books, everything came together that way. 7 out of 10 of our students were Title I eligible. So that was an exciting, we didn't know what to expect. It was a growing pains there, because when you only have 4 weeks to set up a program, and then it takes a while to get students eligible for Title I. So it was a lot of touch and go for the first several weeks. We had IJAG came on site to do several different workshops during the time those students spent with us. So they did resume writing, interviewing skills, workplace readiness, just professionalism, different things like that to kind of provide those extra services, because if these are going to become Mercy colleagues, we want them to be ready when this program ends, or if they don't stay with us, we want to prepare them for their next venture. We needed a financial literacy component. That was part of the agreement that we made with the state of Iowa with the grant. I don't know how I got the information, but we randomly reached out to Green State Credit Union in that area, and they bent over backwards for us. So they had somebody drive in 2 hours each way to present to these students, to go over checking accounts and direct deposit and all the things they would need to kind of get everything set up so they could start getting paid, and it would be just like they were an employee of ours. We also pulled in an educational partner, of course, and I think Dana might have touched on this, or maybe it was one of you touched on this, but NIAC, they were great to work with. That was our logical, we were of course going to contact NIAC because they kind of serve that area. They're close with the Iowa Workforce Development Board. So that worked out really well. One of the unique things about our program, when we went to NIAC, it was kind of like, we don't, that's not a program they have up and running all the time. So we wanted to cram it into 8 weeks. And they're like, we have instructors that might not want to take their whole summer. They're doing family vacations and they normally teach more regularly during the traditional school year. So we actually had our 2 lab leaders were trained to become NIAC instructors during that time. So the students and those lab leaders went to NIAC and actually did all of their clinical labs on site and learning the lab learning on site at NIAC. And they taught those classes. And then they also supervised them in our labs at Mercy One. So they got to spend a lot of time with those students, which I think the relationship was awesome. There were tears at the end of the program because they had built such strong relationships. We also had 100% of the didactic portion of the program was online. So we had the students on site. They were with us 32 to 40 hours a week, but we gave them computer labs and, comfy areas where they could study and do their didactics, snacks, like they had access to our cafeteria. So we provided that so that they could study and learn while they were getting paid rather than send them home, because we don't know what the situation is. Some of these students were working other jobs. They were caring for family members. So being that we had that, especially the large percentage of Title I, we wanted to make sure they were being compensated for all the time they put into the program. And that worked out pretty well. Let me think what else. Some of this, I know I talk fast, so I don't know how much time I have. Or if
You're
there's
doing
any
good.
questions.
Just
Okay.
take maybe one more minute, Jenna.
Okay.
Jennifer,
Successes, believe it or not, I have 3 young adults that I'm raising right now, and some of them I have one that's 22. We had 100% program completion rate. So 10 out of 10 completed, and the attendance issues were very minor. If any, we had very light attendance issues. It was more of like, hey, you got to make sure you're here on time and every day, and then it was fixed. So we were very proud of that because that was a surprise to me. I was expecting we'll lose 3 students, just in my mind, thinking about how some of the youth are, but these students were on site, ready to go every single day, dressed appropriately, and they put forth their best effort. We had 4 permanent hires from this position. So 4 out of 10 permanent hires. We have a couple more that are out pursuing other educational opportunities that I still talk to weekly, because they're like, if something comes open, can you tell me? So we've been working on still some interviewing. So, my hope that 6 out of 10 of these individuals will eventually land at Mercy One as colleagues. I could talk for a lot longer,
that is awesome.
I will stop there.
Thank you so much. And all of this just makes me so excited. And just for folks, if you're not familiar, Title I is usually individuals who have some barriers. And that's where the local workforce area can support some of the things that Jennifer shared. So it's a great thing to include and partner on to help address any barriers that individuals might have in these opportunities. So, but just awesome. Thanks so much, Jennifer. And let's get to Kat. I want to get here very quickly. Kat, you're going to bring us home with registered apprenticeships in healthcare and with Cass Health. And you guys have been doing so much work in this area, such a growing opportunity, I think. So go ahead. I don't want to take any more time from you.
Oh, thank you. Abby's going to let me share my screen because I did not follow instructions very well. So I apologize for that, but I do have some slides. Hold on just one second. You think the HR director would follow instructions, but we don't. Okay, so our apprenticeship program, like Kathy said, we've got several options, but our major one I want to talk about today is our nurse apprenticeship program. Kathy brought up some statistics before, but really the reason why we're looking at, really as far as an HR professional, we're looking at a cliff as far as losing nursing staff. So the nursing workforce is aging. Many of them retire between 55 and 60. And this data is a little old, but 41% are looking at are 50 years and older. So yes, a direct cliff as far as recruitment goes. Our program, so just like many of my other fellow panelists, we are partnering with a local community college. Iowa Western Community College is our is located in Council Bluffs. They serve our area. We have a satellite campus here in Atlantic. And then, of course, Iowa Workforce Development is our other partner. So we received a grant a couple years ago to develop this program. And we are nearing the end of that grant, and we have another one in place for the credentialing grant that I'll get to here in a minute. But our program structure, it's taken us a long time to get here. Just like the other folks said, you have to walk before you can run. We've learned a lot over the last couple of years as far as the structure goes of our program, and this is ultimately where we landed. So it's a 2-year cohort model. We have 16 LPNs. I should back up. We have space for 16 seats in our LPN and 16 RNs. The apprenticeship side of it is 2,000 hours. So they have to complete 2,000 hours of on-the-job training while they're working here at Cass Health. And then they are simultaneously enrolled at Iowa Western Community College in their nursing program. We have Cass Health nurses as clinical instructors. I don't know how many of you know this, but there is also a shortage in nursing faculty as well. So faculty jobs historically don't pay as, I don't want to say as well, because I think that doesn't seem fair, but the pay scales are different. So usually they can make a little bit more out in the field as a nurse. So we are able to supplement that difference while our staff are here working as nurses. They also operated as a clinical instructor. And then our program is also built in. They have a preceptor while they're working their shifts, and then they have an assigned mentor that's also an RN. So they have I'm a higher education professional by trade. I have a master's in higher education, and I know that the barriers that really these students are seeing are the social barriers that, what if I'm not smart enough? What if, oh my God, I got a C+ on that test, I'm going to fail forever. So having these mentors that have already been through nursing school, have seen this, are working at nurses, and they have that time to go get coffee and talk through those kind of socially type things. Financial model, we pay for everything: tuition, books, fees. They get a little money for logo apparel, a good pair of shoes, because we know that's so important, a stethoscope, those types of things. We cover everything. With the caveat, we do require every student to fill out their FAFSA form. So they must complete their financial aid, because why not? If we can get some scholarships and or a Pell Grant, we might as well take advantage of that as well to maximize dollars. And like many of my other panelists, strong internal collaboration. I report to the Chief Financial Officer. So good collaboration with him, and then our Chief Operating Officer, who all the nurses report to. Strong relationship with me and the Director of Educational Services, Brittany Schmidt, here at Cass. We talk every day, and we have a list every day of things that we need to work through and guide for the apprentices. And then buy-in from our clinical leadership and the internal staff is huge to the success of this program. Our structure overall, this is kind of the two-pronged. We've got Cass Health on the left, kind of who's involved, the Director of Education, the RN instructor, the LPN instructor, kind of touched on all those things, and then Iowa Western, and kind of their roles on each side. So we teach so we're kind of a mini campus of Iowa Western. We teach the clinicals, we teach all their labs. All of that is on site here at Cass. And then they are doing their courses as a hybrid online with Iowa Western. So we work closely with the Dean of Nursing and their faculty that are teaching the theory portion of all of that on via online through the Iowa Western campus. We have our own simulation lab here. I'll show a picture of our temporary one and then kind of a floor blueprint for our new one that's coming soon in a few years. But we have our own simulab with mannequins and everything that we are teaching all of that here on site. As far as tracking goes, I'll just touch on this really quick. Competencies, we have all of our competencies built into this program, and they mirror the same that they are completing in their nursing program. So we track that as they're going through the program. And and then move them through their different checkpoints as far as nursing scopes and what they can do and what they can't do. So checkpoint 1 is their CNA. They're all required to have their CNA to be an apprentice. That is also an Iowa Western requirement to be in the nursing program. So our entrance requirements are the same as Iowa Westerns. That was one of the things we learned, that they really can't be different. They are one and the same. But checkpoint 1, full CNA scope. They can do all the things with, as far as their CNA. That's the first part of their LPN. Checkpoint 2, they have completed their first semester of LPN, and these are all the things that they can complete. Checkpoint 3, so on and so forth, as they move through to the RN side of things. They have a badge buddy in there with their badge, like mine, that states the same information. So then there's no confusion as far as what their scope is and what they can do. And then we also have a garage sale sticker, which sounds totally low tech, but it works. We put it right on their badge, what color it is, so then the staff know exactly what they can do when they're looking at them when they're working. As far as our current stats, we're still fairly early in this program because it does take a few years for the program for them to get through, but we've had 3 complete so far. I'm happy to say all 3 have stayed with us on staff. We've hired all 3 of them. We currently have 28 enrolled in the program. LPNs, we have 17. RNs, we have 11. And I am optimistic that I won't have room for all 11 of those once they complete. So what a problem to have. Too many excellently trained nurses. So it's an exciting place to be. And of course, all of this impacts our dependency on agency staff, internal recruitment versus, as we know, external recruitment can get very expensive. So it's just all around, we're producing great, competent nurses internally. So it just doesn't get much better than that. And then our board pass rates, I'm happy to report so far, are at 100%. So this program works, and it's wonderful to see. Looking forward, we are expanding our professions, I should say. So we've got an RT, a respiratory therapy program, up and off the ground and functioning. And then the others are well on their way. So we will see those take a laboratory. I'm hoping January 1, we'll see a lab assistant program up and off the ground. The pictures on the right, you can see this is our temporary space for education. You can see the mannequins they've got a nice study table. They have a little kitchenette kind of back off to the right with a fridge. They can put snacks and all the things students want, right? And then the blueprint is our new space that we will have in a few years. It will be upstairs in our main area. Lots of room. We have a clinical lab. We've got sim. We have an office for our educational staff to be present in the space with the students, and then a nice big conference room for classes. So it is a really exciting time for CAS and for education. We've got lots of other things going on. This is just kind of a drop in the bucket, but the apprenticeship piece is really exciting. So but that I went through that really fast. So, but I could talk forever, just like all our other panelists.
Exactly. Thank you so much, Kat. And this is such new and exciting space. And I just kudos to CAS that has been leading in many ways in the apprenticeship arena for the RN program and now some of the other occupations. We need all of these opportunities. We need the traditional opportunities and we need the apprenticeship opportunities to fill these needs and to make great opportunities available to our fellow Iowans, whatever fits their need. And for this program that Kat and the CAS hospital have been doing is, really giving an opportunity for people to get that RN licensure, that when they still need to have an income, full-time income on a regular basis, which this would have just, many of these people I don't think would have ever had this opportunity had you not set up this program. So we want to grow it across the state in many healthcare areas, because leading back to the data, we need it. We need them everywhere, and we need all kinds of opportunities. So I know our time is up in a minute, but I cannot thank you all enough. This was again, we could do an hour on each of these topics, and we may need to sometime because they're all so critical. And I can just imagine, like across the state, if all students and Iowans had these opportunities, no matter where you were, we can change the trajectory of what it looks like for our healthcare occupations. And that would be amazing. So again, thank you to those of you who presented for us. You're doing amazing work. And thank you to those who joined us today and to those who are listening in the future. We are here to help. As you see, we have experts who have just tons of knowledge. And then we're here at Iowa Workforce Development and Department of Education to help make connections or, share information that others are doing, anything like that in any way we can help. So anyway, there's some contact information. This will come out to everybody. And we will hopefully see you soon. Thanks, everybody.
Thank you.